Good afternoon, everyone, and welcome to the weekly briefing brought to you by the Emergency Leadership Team. I'm Ruth Jackson, and I'm joined today by the other members of the Executive Policy Group, Mrs. Teresa Powell, Dean Joshua Snavely, Dean Joshua Busby, and Chief Mario Holland. So in today's webinar, we'll give you an update on where we are with the CARES Act HBCU grant. We'll also provide the weekly status update for COVID-19 numbers and cases. We will revisit the Protect the Pride plan, and we'll also introduce campus levels and operational postures related to operations in the light of COVID-19. And as always, we will wrap up by reflecting on resilience. So as we've shared in the previous webinars, we had the CARES Act HBCU grant application open through the end of September, September 25th, where over 1,000 students applied by the deadline. The CARES Act HBCU Grant Committee reviewed 845, reviewed all of them actually, all 1,052, and found 845 were eligible based on the guidelines established by the federal government. The award notifications were sent out last week to eligible recipients. And we're excited to share that the award process and refunds for those eligible recipients are currently in progress. By October 23rd, which is this Friday, the application awards should be complete. If there's a student who has questions about their application or the award process, they should email the Emergency Leadership Team or Student and Employee Services. Those email addresses are luelt@langston.edu and luses@langston.edu. Now, Chief Holland will provide our COVID-19 update. Chief?
Thank you, Dr. Jackson, and good afternoon. As of today at noon, the total active cases for the state of Oklahoma for COVID-19, the weekly increase was 7.9%. The total number for active cases for the state of Oklahoma was 5.2%. And the number of deaths for the state of Oklahoma was 6.3%. For Logan County, the total cases was 14.1%. for a weekly increase. For Logan County, the active cases was at 8.7%. And for deaths in Logan County, no change whatsoever in those reporting statistics. For the Langston University total cases as a whole, there are 36 cases, and there are only 6 active cases for our Langston University campus communities. And now, Dean Snavely will share an overview of some of our planned and recent updates to protect the Pride Plan. Dean?
Thanks, Chief, and good afternoon, everyone. As we've watched the numbers grow and as we've learned from our operations over the last several months, we've determined that like we've done since the beginning, that little tweaks and updates need to be made here and there. And so we've begun to revise the Protect the Pride Plan. We want to reflect some of those revisions that have happened since September 1st. So we'll walk through some of those updates today, and that includes masks and face covering updates, cleaning masks and face coverings, something we all need to do. I think we've all have a mask or two that we've kind of used a little bit too long, and maybe it's time to either dispose of that or make sure it gets cleaned. So we'll talk through that. We'll talk through some of the health and safety protocols around what to do when you feel sick or you may have been exposed. We've talked a lot about notification, but we want to review those steps again here today. We'll talk about the impact area cleaning that happens in residential or office or classroom spaces whenever we learn about potential incidents or events that happen on campus that involve COVID-19. We'll walk through some improvements that we've made around our isolation and quarantine units and areas. We'll update you on our testing partnerships. And then lastly, I think many of us who watch the numbers on a daily basis grow concerned as we see national and local trends moving in a negative direction, moving to more and higher numbers. And so we wanted to provide some updates and some transparency around how Dr. Smith and the emergency leadership team make decisions around what our campus level and operational posture is, meaning what are the events, what are the triggers, what are the things, the thresholds that are going to cause our campus operations to change slightly or significantly. So we're going to walk through those so that the campus community has a better sense for how those decisions are made. So first up, we'll talk a little bit more about masks and turn it over to Dean Busby to do that.
Good afternoon, everybody. Thank you so much for joining us again this week. And so as we talk about masks and face coverings, we want to remind you that you should always wear a mask that covers both your nose and your mouth to help protect others in case you've been infected with COVID-19, but you don't have any symptoms. Always when you're in public settings and around people, especially those who do not live in your household, and anytime you're not able to stand or stay away from anybody more than 6 feet apart, you want to always endeavor to wear a mask as well. And of course, as we stated in the first bullet, please always wear your mask correctly for maximum protection. A couple of the don'ts is do not put the mask around your neck or on top of your forehead. Also, don't put it under your chin. We call that chin strapping. And then also, please remember not to touch your mask. And if you have to touch your mask, please make sure to wash your hands first or use hand sanitizer to disinfect before you touch your mask. Going on into how to clean your mask, and there's two ways that you can do it. The first way is you can, of course, clean by washing machine. And so you can always wash your cloth mask with your regular laundry. Me personally, I prefer to wash it with our delegate cycle, especially our LU branded mask, because I don't want to mess those up. And of course, if you have not picked up your LU branded mask, make sure to stop by the Student and Employee Services window to pick up those masks. And so also just use regular laundry detergent and use the warmest appropriate water setting for the cloth used to make the mask as well. And so when you do that, that will ensure that that the mask is clean. And then of course you can always dry it if you want on a lower temperature in the dryer, or you can just air dry. The other way that you can wash your mask or clean your mask is you can also do it by hand, right? And so you want to first make sure that you check the label to see what if you're using any bleach, but make sure that bleach is intended for disinfection. There are some bleach products that may not be suitable for disinfection, such as those designed for safe use on colored clothing. And so then also, as it relates to the appropriate bleach for you to use, you want to use bleach that contains between 5.25% and 8.25% of sodium hypochlorite. Of course, that's just the chemical solution for bleach. And so you do not want to use a bleach product if the percentage is not between 5.25% and 8.25%. Also, you want to make sure that that your bleach product is not past its expiration date, or else it may not be optimal and effective. Also, never ever mix household bleach with ammonia or any other cleanser. And always make sure that you ensure adequate ventilation. I can tell you, if you ever mix bleach with ammonia, it's it's bad. It's very bad as it relates to ventilation and that strong odor and smell. And so if you want to prepare a bleach solution for mixing, relative if you're doing it in a bowl or in the sink, you can always use 5 tablespoons, or that's 1/3 of a cup of that bleach, the 5.25% to 8.25% solution bleach per gallon of room temperature water, or 4 tablespoons of that bleach per quart of room temperature water to make your solution. Of course, soak that mask in the bleach solution for about 5 minutes or so, and then you'll just discard the bleach solution down the drain and rinse the mask thoroughly with cool or room temperature water. And then, of course, as always, make sure to completely dry the mask after washing, however you decide to do that, either in the dryer or by air drying as well. And now to talk more about maintaining health and safety protocols, I will turn it over to Mrs. Powell.
Thank you, Dean Busby, and good afternoon. We wanted to bring your attention back to this section of the Protect the Pride plan, specifically surrounding notification protocols related to when you believe that you have been exposed to someone with a confirmed case of COVID-19, or when you yourself are exhibiting symptoms of COVID-19. There are 5 steps outlined within the plan, and we want to remind you of those and encourage you to remain refreshed on those should you need to employ these steps. So step 1, if you are exhibiting symptoms or you believe that you have been exposed, step 1 is to stay home, self-isolate, do not report to your duty station on campus. If you are a student, do not report to a classroom. We want you to self-isolate and make sure that you are doing your part to maintain the health and safety of others as well as yourself. Step 2 is to notify the individuals who will need to know that you're self-isolating. So that includes sending an email to the LUELT or contacting perhaps a supervisor or an instructor to let them know that you are self-isolating and taking the necessary steps. If you are a student, we encourage you to contact the health clinic, and the information around the health clinic is included in the Protect the Pride plan. Contact information is included. That is a very critical step for students who believe that they have been exposed or who are exhibiting symptoms. Students, you may also contact Dean Busby directly. His information is included in the Protect the Pride plan, and he is a really good resource to reach out to should you be exhibiting symptoms and need to notify the appropriate entities of those symptoms or exposure. Step 3, if you believe you have been in close contact with anyone, we need you to make a list of those close contacts. The CDC defines close contact as being within 6 feet of someone for 15 minutes or more. So make a list of those individuals with whom you believe that you've had close contact. That's going to be very crucial information to share when we get further into the notification process. Step 4, in addition to the individuals with whom you've had contact, we need you to make a list of the spaces on all of our campus locations where you have occupied since the time that you believe you have been exposed or that you have been exhibiting symptoms. So make a list of individuals, step 3, make a list of spaces, step 4. And finally, step 5, you're going to take all that information and you're going to use it to complete the notification form. This is the form that we have talked about in previous webinars. It is located on our COVID-19 resource page. It's also linked on this screen conveniently on the QR code. You can find it in the Protect the Pride plan itself. There's a notification form QR code posted at Student Employee Services at their cashier window. There are lots of places where you can find this notification form QR code and link should you need to use it. So you're going to use all of that information that you collected and you're going to use it to complete the notification form, which comes directly to the ELT. And we use that information to conduct our contact tracing, which is a very critical step of our process. And now I'm going to ask Dr. Jackson to share more with us on the procedures and protocols related to cleaning and disinfecting spaces once we receive a notification. Dr. Jackson.
Okay, thank you. I just want to reiterate the cleaning process and the disinfecting process. As Mrs. Powell mentioned on the previous slide and the steps for notification, based on the notification form, the university will close off any space that has been used by a person who's been exposed or a person who is sick. And no one will use these spaces until after it's been cleaned and disinfected. Our Sodexo facilities team will wait 24 hours before cleaning and disinfecting a space. Now, it's important to note that the 24-hour period begins after the last person has been in the space, not necessarily the person who's been exposed or the person who's sick. Again, the space has to be uninterrupted for 24 hours by anyone. If 24 hours isn't feasible, then the Sodexo facilities team will wait as long as possible before cleaning the area. This will be done to ensure that the space is safe, and they will make sure that the storage of cleaning and disinfection products are properly done. So I will send it over to Dean Busby to talk about isolation and quarantine areas.
Thank you, Dr. Jackson. And as we talk about designated isolation and or quarantine areas on campus, the university has identified several isolation rooms and areas within our on-campus housing community to essentially isolate anyone who has either COVID-19 symptoms or students who test positive but did not have symptoms. But either way, those individuals for precautionary reasons would be quarantined in those designated spaces. The University Health Services will and has continued to use guidelines outlined by the CDC when caring for those who are having these symptoms and or who have tested positive, and we're currently continuing to follow those. And really happy to report and thankful that through the generosity of the Langston University Foundation, our Student Government Association, our alumni, and other key stakeholders, the emergency leadership team and residential life and housing services staff now provide care packages that include hygiene kits and other critical household items at the beginning and throughout the duration of isolation or quarantine for our students. And also, in addition to that, Sodexo Dining does provide daily delivered meal services. So breakfast, lunch, and dinner, Monday through Friday, as well as brunch and dinner on Saturday and Sunday. Sodexo Dining does deliver those meals to our students that are in quarantine. And so at this time, I'm going to toss it over to Chief to talk about testing.
Thank you, Dean. So at this time, neither the CDC nor state or local guidelines include COVID-19 testing as required or recommended protocol for returning to school or work. Test results only reflect a brief snapshot in time. As a result, the university does not conduct universal testing, but refers individuals to appropriate off-campus providers for testing on a case-by-case basis. The university has created layered strategy, which does not rely single points of defense. Rather, we employ a multi-layered approach designed to isolate, contain, and mitigate the risk. And now I'll pass it back to Dean to continue to tell you about testing. Dean.
Thanks, Chief. And as it relates to testing option, the university currently has partners with the following organizations to provide testing for members of our campus community. And when we're saying members of our campus community, we're talking about faculty, staff, and students. And so currently we have our university community can go to the Logan County Health Department, Mary Mahoney, which is operated by Community Health Centers Incorporated, and there is a location here in Langston. Also Express Wellness Urgent Care, which is located in Guthrie. And actually, ironically, Express Wellness Urgent Care is literally just in front or just due east of the Logan County Health Department there in Guthrie off Division. And so what you see there is COVID-19 testing at Mary Mahoney and Express Wellness are available with current health insurance. The Logan County Health Department does not require that you have health insurance. It's actually free. There's no insurance information that's going to be asked if anybody contacts them, but you do have to have insurance at Mary Mahoney or Express Wellness, and the test is covered within your health plan coverage. So if a member of the Langston community has any questions, they are welcome to contact either our health clinic at the number there, 466-3335, or of course, they're welcome to send an email to the emergency leadership team via the LUELT@langston.edu prior to testing, and we'll be able to address any and all concerns or questions that you may have as it relates to testing. Now, I'm going to turn it over to Dean Snavely to begin to talk about our campus levels and operational posture. Dean.
Thank you, Dean Busby. As I mentioned at the beginning, now is a time when we're seeing case numbers rise around the U.S. Locally, both in our county and at the state level. And we believe it's important that our campus community have a sense for how Dr. Smith, our president, and us as the executive policy group and our emergency leadership team make decisions around the operations of the university. So we're going to outline here today 4 different levels to help you understand and to help frame how these decisions get made. These levels all have a description of the varying categories of events and different areas of campus operations, as well as the key decision thresholds that accompany what would change us from one level to another. So what you're seeing here on the screen currently is level 1. And level 1, think back to a day, it's hard to even remember that sometimes, but pre-COVID and what life was like, that's what level 1 is. So coursework included traditional instruction. There were no limitations or restrictions. We had campus events with no restrictions. Homecoming looked quite a bit different from last week in a level 1 life. Housing had regular occupancy and operations. And then campus operations themselves, we had regular access to the campus and everything was, quote, normal. All research activities continued in a regular fashion in a level 1 setting. CDC would refer to this level of disease within the community as endemic, or sort of like a community baseline, right? Just a regular level of community disease. Level 2, the next campus level in operational posture. Wait for the slide to change over. There we go. There's a little bit of a delay sometimes with the web system we're using. So level 2, the description of the areas you'll see there. So coursework, this is the level we're in now. So flexible, hybrid, and web instruction with enhanced protocols and safeguards. Our events are limited to 10 persons or less. And we have, of course, enhanced protocols around that. Housing, we do have regular occupancy, but with enhanced protocols and safeguards, and currently single occupancy in our traditional dorm style housing. Reduced access from an operational level and hybrid operations, which includes staffing, rotations, changes to office layouts and setups, and more discretion for supervisors to build a schedule that increases physical and social distancing. All of those kinds of operational changes are built around enhanced protocols and safeguards. And our research activities continue in this level, but with similar precautions. From a decision threshold standpoint, the level of disease outlined here can be either an epidemic or a pandemic. And for the Langston campus, especially, I'll give you an example of how we're operating currently. The active case level we've identified should be between 0% and 3% of a particular campus site or location. So just give you an example, this isn't a perfect framework because the number of folks on the campus changes on a regular basis. So we would always be looking at that exact moment in time. But this would typically be between 1 and 40 cases. 1 in 40 active cases would be indicative of this level 2 operational posture. And it would be once we got beyond that approximate level of active cases that we would shift into level 3. And so I'll turn it over to Mrs. Powell to talk about that level.
Thank you, Dean Snavely. So as Dean Snavely described, we would shift then to a campus designation of level 3, which would mean that we're shifting to fully remote and online instruction for courses. For gatherings on our campuses, we would have no in-person events or meetings. So no in-person events or meetings would be authorized should we shift to a level 3 posture. For housing, that remains largely the same. So we would continue to have regular occupancy in our apartment style living with enhanced protocols and safety measures that are already in place. And we would continue to operate with single occupancy in our traditional dormitory, which is Young Hall on the Langston campus. Campus operations would shift to restricted access, much like we had in the late spring and early summer when we restricted access to all of our campuses. And for our employees, we would shift to significant telework. So we would shift away from a campus density level that we have right now in level 2. We would try to mitigate that density and rotate our staff, have emphasis on telework so that we have fewer members of our faculty and staff on campus at any given time. All research activities would continue. They would have enhanced protocols and safety measures in place. The decision thresholds related to level 3 posture include epidemic or pandemic level of disease as described by the CDC, and we would look to see what the case level is within any of our Langston University campuses or sites. For level 3 specifically, the active cases would fall anywhere between 3% and 5% of any campus site or location. As an example, for the Langston campus, that would mean that we would have between 40 and 75 active cases in order to shift to a level 3 posture. And now I will ask Dr. Jackson to share more on the final level, level 4.
Sure. For the level 4 campus designation, course instruction will remain remote, including web or online instruction. As in level 3, there will be no in-person or face-to-face meetings. For housing, we would shift to an emergency occupancy only model where we'll have strict protocols and safeguards in place. For operations, the campuses will have restricted access and there would be mandatory teleworking with authorization and very few exceptions. In level 4 campus designation, the research activities will be restricted and authorization will be required for those to continue, but this will be done with limited exceptions. The decision thresholds include the level of disease being at pandemic and one of the following 3 scenarios. If there are active cases on the Langston campus, within Langston University that exceed 5%, again, on any given campus or site, or if Logan County, Oklahoma County, Tulsa, or Carter counties issue a safer at home order, or if there is a statewide order for safer at home. Those would be the thresholds that would determine and yield a level 4 campus designation. So at this time, we will pause and allow for any questions that you may have. Please enter them in the chat or in the Q&A. Okay, so we have a question about research classes. We'll follow the designated levels. If we are in a level 3 or level 4, then all of the instruction will be remote, which will utilize our Zoom and some of our other technology that's available. We will not allow for those research classes to continue in a level 3 or a level 4 posture.
Dr. Jackson, there's a question from one of our faculty members. If a faculty member is self-isolating for 14 days, but still manages to conduct the lectures synchronously or asynchronously from home, should these 14 days be taken out from COVID leave or any other leave that the faculty member has?
So we would ask, or Doc, do you want to go ahead? Sorry.
Now, the important piece is to communicate this with your immediate supervisor and also Mrs. Buckley and Student and Employee Services. If you are able to continue the responsibilities of your job and there's agreed upon accountability and processes in place, then you would not have to deduct this from COVID leave. However, if you are unable to perform any of the duties related to your job responsibilities, then yes, you would deduct it from your COVID leave.
Now, I would just add, it's not always not an all or nothing proposition. You may take some hours of sick leave or COVID leave if you were getting tested or needed to rest, but felt well enough to conduct some duties. So as Dr. Jackson said, it would just be about reaching out to AVP Buckley and your supervisor and really working through the details. But there's a lot of flexibility there to ensure that operations continue and you get to be protected and get that time that you need.
Okay, are there any other questions? Okay, if something comes to mind once this webinar concludes, as always, feel free to email luelt@langston.edu. And so now for our weekly installment of Reflecting on Resilience. We'd like to highlight a collaboration that's occurring within our STEM areas. Earlier this semester, Dr. Peterson, Dr. Quinn, and Dr. Coleman hosted a small group of administrators from the Oklahoma Medical Research Foundation, or OMRF. The team toured our state-of-the-art Science Research Institute, and they were very impressed. And the group spent some time talking about potential collaborations between Langston University and OMRF. These could include research opportunities, especially for our students. Later this week, the Langston University team will visit OMRF. That would be Dr. Peterson, as well as several of our STEM faculty members. They'll visit the OMRF facility and meet with individual scientists to discuss the scientists' varied research project agendas and, again, explore opportunities. So even in the midst of this pandemic, we continue to develop partnerships with the goal of increasing opportunities that benefit our students, but always in a safe manner. Notice the masks and the social distance. So thank you to Dr. Peterson, Dr. Quinn, Dr. Coleman, and everyone in our STEM areas for the work that you're doing to create these opportunities for our students. So that brings us to the end of this week's webinar. Please join us next Monday, October 26th at the same time, 3 o'clock, where we will discuss residential life and share housing move-out protocols. Thanks for joining us, and as always, take care, Lions.